Good afternoon, and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here during June each Monday and Thursday at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. Today, for questions during the forum, please email us to plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today, Ken Tavares, Matt Muratore, and I will be joined by a panel of participants. They include Dr. Phillip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. Also, Christopher Smalley. He's the Senior Director of Marketing and Communications, Beth Israel Deaconess in Plymouth. Martha Vautrain from the League of Women Voters Voter Service. Lawrence Pizer, our town clerk in Plymouth. Robert Eisenstein, Senior Living Consultant. Stephen Cole is the Executive Director, Plymouth Regional Economic Development Foundation. Well, Ken, it's been a busy week. What do you have for us today?
That is an understatement, Steve. It certainly has been, and we expect that it's going to be busier as this week comes to a close. What I'd like to do this afternoon is talk to the restaurants in Plymouth. Hopefully on Saturday, the governor will give us permission to open up more for outdoor service. So I want to make the following statements and very carefully give you some numbers that you can contact if you own a restaurant in the Plymouth area. If you are a restaurant that wants to expand food and beverage service onto private property, please send your detailed request along with an informal outdoor seating plan to ljohnson@townhall.plymouth.ma.us. Also, this is Lisa Johnson's number that I know many of the restaurant owners are familiar with Lisa and the work that she does with permitting. Lisa's number, if you don't want to email her, is 508-747-1620, extension 10100. And that is if you have any questions. If you are a restaurant that wants to expand food and beverage service onto public property, you will also send your detailed request and an informal outdoor seating plan to scale. Lisa then will mail you a restaurant expansion permit application to fill out. It's very important. We're going to need that application back. Now, the Board of Selectmen has a special meeting scheduled just to work on restaurant permits for Monday at 10:30 in the morning. Also, we will post meetings if they're needed for Wednesday, Thursday, and Friday at 9:30 next week. The board is trying to make this as easy and have availability to go through the individual requests. We also understand that there's going to be some additional information brought to our attention from the Chamber Task Force as to traffic in the downtown. And we will get back with more of that information as it's brought forth to be discussed by the board. But again, if you are a restaurant and you want to expand that service, again, send your plans to ljohnson@townhall.plymouth.ma.us. And also, if you don't want to email it, please call 508-747 747-1620, extension 10100. And the staff is going to make themselves available to get as many of these permits in at the beginning of the week. I'd also, at this time, like to thank everyone that was involved in the vigil last night in Brewster Gardens. It was extremely moving. There were wonderful speeches that were made, and it was very, very peaceful. I thank, on behalf of the town, every organization that was involved, our police department, our fire department, and really appreciate how everyone cooperated and made this a vigil that we hope can be repeated in other communities. Also, I'd like to take a minute to talk to the seniors from Plymouth North and Plymouth South. We have sent you other messages in the last week, but publicly on behalf of the town and the Board of Selectmen, I want to wish you well. This is not the end of the year that you expected to have, but we all recognize that in time, we know that you will have grown stronger from what you're going through. We wish you well. Some of you are going off to school, some of you to the workplace, and others into the military. We wish you well and know that you are prepared and will be prepared more so to be the new leaders of tomorrow. Congratulations to all of the graduates of Plymouth North and Plymouth South. Back to you, Steve.
Thank you, Kenneth Tavares, Chair, Plymouth Board of Selectmen. And we're now going to go to our health component. And Dr. Phil, we've been hearing a lot this past week about vigils and other remembrances. We also still have a coronavirus, and Plymouth's responding to that. What do you have for us today?
Steve, you must have telepathy, because that was number one on my list of things to talk about today. I do want to say, I think it's a very sensitive subject right now. And frankly, I've been a little disappointed that I haven't heard more from, political leaders and public health leaders during this past 10 days or so with all the protests. I think it's very evident if you look at the major cities that, social distancing is not being practiced very well at all in these large group protests. And I'll be very interested to hear from Dr. Wilson later during our broadcast today to see what his opinion is. But my opinion is, of course, being outdoors is less of a risk. If people are wearing masks, that helps. But you can see people are shoulder to shoulder. People are yelling. Not everybody's wearing a mask. To me, I 100% support racial equality. I think that there's no question that we have inequalities still remaining here that are racially distributed, against Blacks when it comes to being apprehended and stopped by police. And obviously this very unfortunate death that occurred in Minnesota. I 100% support everyone's right to protest, but of course we want peaceful protest. We want nonviolent protesting. And then, I want to add to that, I want people to do, a safe social distancing protesting. And so that would be my call for action, is to say, if you're going to have any type of protest or vigil, just be, smart about it, because we are in the middle of a pandemic. And I do think, we are at risk of spiking our numbers here, throughout the country with all these protests. So great question, Steve. And we'll see how this goes, going forward in the next few weeks. I did want to talk to you about a sobering experience I had this week. Unfortunately, one of my patients committed suicide, and being in practice for about 30 years as a primary care physician, I think this is the second time I recall having a patient commit suicide. My patient was 69 years old. I don't think it was totally COVID-19 pandemic related. He lost his job in about October, having severe financial problems. He was having severe legal problems with his ex-wife. He was threatened with being jailed. He had to raise $35,000 to stay out of jail, had to borrow the money. Then a long-term relationship he had with his girlfriend of 10 years was falling apart under all this stress. And, I had referred him to a psychiatrist for the last few months, and we'd been treating him with medications. Part of the pandemic problem was that, we don't have some of the outpatient intensive programs that normally we would have. Some of those are closed right now. Although, as we enter phase 2, I expect more of these to be available. So I think he was somewhat impacted by some lack of availability of resources due to the pandemic. But the reason I bring this up is, first of all, it sort of stopped me in my tracks when it happened on Tuesday, just to remind me that, you have to be sensitive to the despair that some people are feeling, whether it's related somehow to the pandemic impacts, whether it's health impacts, economic impacts, but you have to be aware and you have to reach out and offer help to people. And, I want to continue to do that in my job as a healthcare professional, be aware, when people need help. And I would just encourage anybody who's out there listening to think of the same thing. If you've got friends or family, anybody that you're worried about, that you think, is, severely depressed, make sure they get help, whether they, go directly through their primary care doctor, or go through suicide hotlines. I mean, usually if we have people who are suicidal, we evaluate them in the emergency room. This particular patient, I knew he was high risk, but, he would not reveal he was hiding, that he had a plan to kill himself. And it was just unfortunate. But be aware of what's going on around you, because these are really tough times we're having right now. And I'm sure that, there's a lot more stress out there than we normally have. On a good note, I do want to point out, I know that, Bob's going to talk later about this, and maybe you'll hear a little bit from Matt as well. But, we're now able to, have a limited visitation policy now for the assisted living nursing homes. I think people have to meet outdoors at least a 6-foot distance with masks, and you'll be able to hear more details about that. But I feel that's a great thing for families now. They'll be able to, get together, and a great thing, for the patients who are living in these. The hospital still, as far as I know, still not allowing visitors. So we've got a little bit more way to go there. On Saturday, the governor will be talking about if we're ready to enter phase 2, at which time I think, you'll see, further loosening of the restrictions. You'll probably see more availability, as I've mentioned, about elective procedures and surgeries, et cetera. I think we're doing a great job in Massachusetts still. Our numbers are coming down significantly. It's going to make it a lot safer. I think Matt's pointed out several times, if you're over 60 years old, you've got medical illnesses, even as things open up, you probably want to be more cautious about how much you do. You're probably going to want to socially distance more if you're more at risk. That's all I have for now. Happy to take questions later during the broadcast. Thank you very much, Steve.
Thank you. Dr. Phillip Triffletti is a primary care attending physician at Beth Israel Deaconess. And Phil and I have not spoken for several days, and yet you'd think we planned this before the program. Unfortunately, this morning I also received a call from a client who in the past few weeks has lost a child, an adult child, to suicide. And so again, on Monday, Sarah Cloud, Director of Behavioral Health at Beth Israel Deaconess, will be speaking to us, and I have asked her to talk about the resources that are available locally now during the pandemic. At this time, we're going to continue our health segment with Dr. Mark Wilson. He is an epidemiologist that resides in Plymouth. Welcome, Mark.
Thanks very much, Steve. Sorry to hear about these suicides, but this is the reality, and it's good that we're able to share this with community members. I thought I would try to answer a few more questions that have arisen during this past week. I'll start with one that reads, with the decline in cases, do I still need to be careful about getting infected from objects like surfaces, doorknobs, etc.? Is that still a risk? Risk is a relative term, as we all know, and for the COVID virus, there are various modes of transmission that are possible, and some are more or less likely than others. We know that transmission cannot occur by, for example, the bite of an insect, probably not by food. But the most important mode of transmission we do know is droplet transfer, typically from the mouth, or possibly from the nose by sneezing, by speaking, or by stinging. Therefore, it's really still important to wear a mask in public settings. As for surface contact with the virus, the COVID virus generally doesn't survive all that long on most surfaces. And remember that even if you do contact the virus, transmission still requires you to touch that surface first and then touch your nose or your mouth. And so there's a relatively low risk of contracting the virus through contact such as that, but it is technically possible. So it's still a good reason to wash your hands frequently, even though the risk probability is declining because overall in the community, fewer and fewer people are symptomatic and infectious. It's also really important to continue to wear masks in close proximity with people. People can be asymptomatic, remember, or they can be pre-symptomatic and still infectious. And as Dr. Triffletti just said, during protests and vigils that we're now familiar with, we really should, especially in those contexts, practice safe social distancing, even while we're focusing on other important needs in our society. The next question is, a lot of people are sneezing now. Does this mean that more COVID virus is being transmitted? Again, remember that you can only infect someone else if you are infectious, but you may be asymptomatic or, as I say, pre-symptomatic. In fact, most of the sneezing that's going on right now is probably due to the very high pollen counts, especially certain trees and certain grasses. And so it's all the more reason to cover your coughs and sneezes with your arm, but even better to wear a mask. But those sneezes are not necessarily infectious. So if someone sneezes in your face, don't go running away with the fear that you are sure you're infected. The next question is, I'm told that the risk of being infected by the COVID virus is greater indoors than outdoors or outside. Why is that true? The process of transfer of the virus occurs most often when people talk, sing, sneeze by droplet transfer. And what these droplets do is they are ejected and land on mucous membranes, usually your nose, or if you're breathing at the time, perhaps deeper into your respiratory system and eventually down into your lungs. There's some evidence now to show that actually the virus is best able to replicate on cells in the nasal passage and much less so deeper down into the lungs, but occasionally viral particles do get down there, and then that can cause severe respiratory disease. But when you're out of doors, these particles are still being produced, but they're dispersed. There's a dilution that occurs. And so the amount of inoculum, the amount of viral particles that you actually receive, typically is less, even if you're at the same distance. But nevertheless, there still is a probability, if you're close, that you could be exposed to someone's just speaking to you. So if these particles then land on your nose or even on your mouth, as opposed to your skin, you are at risk of infection. And wind direction, then, if you're out of doors, becomes really important, and much less so indoors. So it's not as though if being out of doors, your risk has declined to zero. It might be a little less, but it's still real depending on the circumstances. And I just wanted to add a little commentary here. My own, I'm embarrassed to say, unscientific, brief set of observations over the past week or so. I regularly go running along the waterfront every day, and usually along Union Streets between Stevens Field and Nelson Park. And depending on the day and depending on the time of day, it's usually in the late afternoon. I've estimated now, well, I count each time, and the ballpark numbers are between 55 and 70% of the people do not have a mask, even around their neck. And so when I run, for example, I have my mask around my neck and I pull it up when I come close to somebody. I have to be close to somebody to be infected, but more importantly, I can't infect anyone else unless I'm close to them as well. I know it's easy to forget this, but we should really have one available if you cannot keep a safe distance. And we can't always guarantee that, especially walking down around the waterfront or even outside in any situation where we're likely to be in close quarters. One other brief comment that I wanted to make, and I'm not sure if perhaps Matt or someone else on the team here will comment on this, but the Commonwealth has now begun a new counting method for COVID cases. Basically, for COVID cases and for COVID-related deaths. Basically, they, in the past, have only reported confirmed cases. A confirmed case is a case that has symptoms and or contact, usually symptoms in this new arena around COVID, and a laboratory test that confirms that indeed was the cause of the symptoms, in this case, the SARS-CoV-2 virus. The Commonwealth has now begun to add in their daily reporting for both cases and related deaths, probable. And what probable means here is that the confirmatory laboratory test has not been made yet. The results are not available. Most of those probable cases will eventually likely be confirmed once the test results are made available. But it may look as if there's a sudden inflation in the number of cases or COVID-related deaths. But that will, of course, eventually be adjusted. And so just keep that in mind if you're seeing jumps. Until today, through today, we have continued to decline in the state, and both in deaths and in number of new cases. And so, as I say, perhaps Matt or someone else will want to comment on that. Let me stop there, and I'd be happy to answer any questions later on in the program.
Thank you, Dr. Mark Wilson. He is from the University of Michigan School of Public Health, Department of Epidemiology. He and all the members of our panel can answer your questions. Send them to PlymouthInfo@pactv.org. And as we conclude our health segment, we welcome back Christopher Smalley, the Director of Marketing and Communications at Beth Israel Deaconess in Plymouth. Welcome, Chris.
Thank you, Steve, for the appearance here, and a big thank you also to Drs. Wilson and Triffletti for their service during this COVID pandemic, and everybody on your panels today and past shows as well. And when I stop to think about it from the perspective of the community, the Plymouth community has really rallied together, worked very well together to manage this pandemic. And then more locally at Beth Israel Deaconess Hospital, Plymouth, for all of the 2,000 employees that work there, the nurses, the doctors, the support staff, the hospice workers, everybody in our outpatient settings, they show up to work every single day to make sure that your viewers and listeners are safely cared for. By the numbers at the hospital, we are seeing a decline in the number of patients presenting with COVID-19. As of right now, there's 16 positive patients at the hospital and 28 suspected positive patients. So it's about 44, which is much lower than when I was last on this about a week and a half, 2 weeks ago. We continue to see COVID patients, obviously, and to treat them, but like businesses in Plymouth, like the state of Massachusetts, we are now sort of shifting our focus while we continue to treat those patients to recovery or reopening, as the state has been saying. So a couple of things that we're going to be urging patients when they do return to the hospital. We'll learn more from the governor on June 8th about phase 2 and the elective surgeries. There will be social distancing that has to happen within our facility. We're educating our employees about that right now. Our facilities department has been hard at work putting up new patient flow areas, if you will, floor decals to say stay 6 feet back or behind this line. When people do come to the hospital, we have a number of entrances. We'll only have a few open. And screening will continue to go on to see if patients may exhibit COVID-like symptoms. We, as Dr. Triffletti had mentioned, we do not have, or I should say, we're not allowing visitors at this point. And those visitors' restrictions will most likely stay in effect even as we go to phase 2 and begin to open up elective surgeries. But we'll know more about that later next week. Some of the things that we have already opened up with scheduled appointments, all diagnostic imaging is open right now, but again, by appointment. We have blood draw stations throughout the region and one on Cape Cod. Those are now open. Again, it has to be by appointment. And depending on the size of the waiting rooms, people will either be asked to socially distance 6 feet apart. If there's not enough room, they would be asked to wait in their car or in a cell phone lot that we're going to designate at the hospital. and then they would be called when space is available. We also just want to let people know that all of our specialty or ambulatory practices do offer telehealth. And the best way for your viewers to learn if they have a specialist who does offer that would be to call that office, their specialist office. But also they can go to our website at bidplymouth.org to see a listing of all the telehealth options that are there. The big question that everybody has is, when can I come back for elective surgeries? When can I come back for elective treatments or procedures? We'll know more early next week when we learn from the governor about the phase 2 reopening in Massachusetts. And we're following all of those guidelines as well as those from Beth Israel Lahey Health, our parent organization in the hospitals. So that's the Beth Israel Deaconess Hospital Plymouth update for now. Obviously, entertain any questions that people may have toward the end of the program and a closing statement at that time. But again, thank you to everybody on this panel for all that you're doing to keep Plymouth safe. Thank you.
Thank you. That's Christopher Smalley. He's the Senior Director of Marketing and Communications, Beth Israel Deaconess in Plymouth. This time we're going to go and talk a little bit about elections. We had an election recently in Plymouth. We've got one coming up. And today we welcome, for the first time, Martha Vautrain. She is a longtime member of the Plymouth Area League of Women Voters, and she is also involved in voter service. Welcome, Martha.
Greetings to you, Steve, and to all the other guests. And thank you for having me on today to talk about elections and voting, which is the main reason for starting the League of Women Voters 100 years ago this year. And the reason for me being here during these pandemic times to talk about some of the solutions that are being considered and instituted in the face of challenges to election and voting. In Plymouth, we have 3 elections coming up. Saturday, June 20th is the local election with openings on committees such as the Select Board, School Committee, town meeting members. And Tuesday, September 1st is the state primary election. And then November 3rd is the presidential election. Regarding the local June 20th election, voters will have the chance to vote in person as we did during the recent May 19th election. And measures will be taken to conform with all pertinent COVID precautions. Voters will need to wear a mask and probably bring their own pen if they can. Voters will also have the choice to vote by mail, but you must start that process now, since the election is only 2 weeks and 2 days away. So ASAP, apply for your ballot, just like you did before May 19th. You have a few options. One is to go to www.plymouth.lwv.org, our homepage, and follow the simple instructions. Okay. It was just set up yesterday. We checked it out, and hopefully it'll be working. Or we can try, or you as voters who want to mail in your ballot, apply for your application through the Plymouth Town website. And this is a long one, but it will be on your screen. And you can get right to the early ballot application. And that is www.plymouth-clerk/town-clerk/absentee-ballots.
No money.
To get your ballot application, and then return, when you receive it, return your ballot.
I showed the whole thing.
And I know this is a long email address, but it does bring you, as I mentioned, directly to the instructions. And I also want to talk about the September 1st and November 3rd elections. Our Massachusetts State House representatives have been hard at work drafting election law legislation that, among other things, would hopefully expand and simplify voting by mail. One of the provisions under discussion would allow the Secretary of State to mail a ballot application to each registered voters. You wouldn't ask for it. It would just come to you in the mail. And then you can return that application requesting a ballot for September 1st election and or a ballot for the presidential election in November.
Here, if you want to bring this up for.
However, at this point, unless Matt Muratore, our representative, tells us differently, I don't know for sure if that will be part of the bill.
Okay. you can do this.
But at some point soon, hopefully, the House will pass a bill, and then that version will go to the Senate, who will then hopefully pass a strong bill quickly, because time is of the essence to allow state and municipal offices enough time to set up all the provisions, in time to mail out the applications, and then allow time for the voters to receive those applications and then mail back their ballots for the September election, then receive and return their November election ballots. So if you need to be in contact with our state legislator, their state senator, because soon this bill will be in the Senate, about any of these important matters, you can email her at susan.moran@masssenate.gov. So stay tuned for more information that I'm sure Matt will be bringing us regarding mail-in voting for September and November, because it will hopefully be different than what we're doing right now. And remember to vote June 20th. All the polls will be open from 7 a.m. to 8 p.m. as usual. And I also want to mention, after being at a meeting earlier this morning, that if you decide to drop your mail-in ballot at the Plymouth Town Hall, that drop box is in the back of the building at the rear entrance on the wall
Pull it down.
to the left of the door. It is a smaller mail slot with a larger box that receives everything that gets dropped in that slot. And if you feel like you have to fold your ballot, you can do that in your ballot in your envelope and insert it into that drop box. And I am willing to answer any questions, although with Larry Pizer on the show following me, I'm sure he will be able to help out with any questions that voters might have about voting here in Plymouth in the next 3 elections. Thank you.
Thank you, Martha. Vautrain, Plymouth Area League of Women Voters, Voter Service. And as Martha has indicated, we're now going to go and welcome back our town clerk, Lawrence Pizer. Larry, since the last time you were here, you had an election, and you're still going to be with us for a few weeks. What do you have for us today?
Well, first of all, thank you, Martha, for all of the material that you provided. Let me make one correction. 7 a.m. to 7 p.m. Town elections are 12-hour elections, unlike the state elections. 7 a.m. to 7 p.m. Going through some of the matters that have come up since the last election, there is a box. It is at the upper level of Town Hall, the one with the parking lot connected to it. People have asked why the box is so small. The answer turns out to be security. It is very important that we do what we can to protect the ballots. The danger in having a larger opening is that some people might put something other than ballots or checks into that opening. So we are protecting the ballots. That's why we have it there. I know it says on the ballots, please don't fold them, but you will have to fold them if you're going to put them into that slot. It might very well be the safest way of assuring that your ballot is going to be getting back to town hall on time. There was also a question at the last election about signage. We suspect that most people at that election knew how to find the polling place, but we do have signs at the polling places. What changed is the staffing. The custodians might be different people. They also have a very different schedule. We are going to be working with them to make sure that the signage that we have provided them does go up. The mail-in ballot process, very important to understand that it is a bit time-consuming. When you make a comparison between the mail-in process and the voting in-person process,
That's what you want me to bring up?
it does take a lot more time for the mail-in process. But in the present situation, and considering what this television show is about, that is by far the safest way for everyone to vote, and we do encourage people to vote by mail. That having been said, do it now. It takes some time for your request to get to us. It takes a bit of time for us to process your request. It takes some time for us to send you the ballot, and then it takes some time for the ballot to get back to us. So understand that it's necessary for the ballot to be in our hands by 7 p.m. on election night. So if you have any question about whether or not your ballot is going to make it by mail, very much encourage you to use the slot at Town Hall that we've described. These are not normal times, and the election process, therefore, is not the same process that I've been experiencing for 28 years. We have a whole different staffing process in order to protect the people who work for you, who work for the town, and that has affected, to a degree, the speed with which we can act. However, starting on Monday, we are expecting the full staff of the town clerk's office to be present all week. And therefore, if you get your request to us, you will get your ballot in a reasonable time frame for you to return it to us. Again, very, very strongly, please do it soon. We had far too many ballots that came back to us in the mail the day after the election and 2 days after the election. And there's nothing more painful for me than having a ballot that was properly executed but arrived too late because it can't be counted. From the town clerk's perspective, one of the matters that is also happening with the legislative bills that will deal with the elections this fall, the process that presently exists is a cumbersome process. And there are some matters that are before the legislature to make it possible for town clerks to operate more effectively. One of them is when your ballot arrives at town hall and is put into the computer, it's a problem. Each individual ballot, you have to enter a name. We are trying to convince the legislature to have a barcode on your application when the secretary sends out those applications. And also, once it comes in, you can just imagine the challenge of filing 20,000 or 25,000 ballots that we would expect to get for the November election. We're hoping that the legislature is going to allow us to get a central tabulator and allow us to enter the ballots into that tabulator immediately rather than holding them for election day. Those of you who who feel that there are challenges in the election process, very strongly recommend that you get in touch with Secretary Galvin. He is the chief election officer for the state, and he is the person who needs to be going to the legislature and advocating the best practices for elections. Poll workers, for those people who feel that it's safe to work at the polls, the town is looking for poll workers. If you can call the assistant town clerk who is going to be operating that election, her number is 508-322-3301. You can leave a message, or if she's there, I'm sure she'll be happy to talk with you. Thank you, Steve.
Thank you, Town Clerk Lawrence Pizer. Please send your questions to PlymouthInfo@pactv.org. And next we're going to go to Robert Eisenstein, Senior Living Consultant. Bob, Larry tells us these are not normal times, and you've been reminding us when it comes to skilled nursing facilities, assisted living, that protocols have changed. What's happening now with the reopening?
Yeah, let me talk about that. First of all, thank you, Steve. So just 3 areas I want to talk about. One, I'll start with the good news, which is the lifting of the restrictions on visitation. And then we'll talk a little bit about the numbers. And then I think most importantly, I think we're entering a new phase in general in the nursing home industry, where we're going to hopefully see some permanent changes to prevent pandemics and infections going forward. So first of all, like Phil Triffletti started to talk about, on June 1st, CMS, which is the Center for Medicare and Medicaid, put out a very lengthy memo regarding changing some of the guidelines in nursing homes, and then that comes down to the state. So effective pretty much immediately, visitation for nursing home residents, they have to be negative, totally negative from any coronavirus, which means having 2 negative tests and no symptoms. They will be allowed to have visitors in an outside open space, like Dr. Triffletti had mentioned. And visitors who are coming to visit them are allowed up to 2 visitors at any one time per resident. And the visitors will also be tested when they arrive on the property. So there's going to be temperature checks. There's going to be a questionnaire that they will be asked to ensure that they are also symptom-free. And as long as they pass that test and have no current temperature, they will be allowed to visit with their loved ones. So it's great news. The other exception that's always been made, and just to remind folks, for compassionate care, anybody obviously who's at end of life in the nursing home, regardless of the reason, the visitors will be allowed to visit inside, again, taking precautions while they're visiting. The other thing that's happening during the visitation, a staff member will also be accompanying them at all times, just to ensure social distancing, ensure that everyone's wearing masks. So it's very good news. I know this has been the biggest thing that people are talking about, and we all talk about the issue with social isolation. So it's really great news. It really reflects the fact that I think we've finally seen the curve bending in nursing homes, and we've talked about that. So moving right into the numbers, just very quickly, and this is as of ending yesterday, the total number of cases that have come, testing that's been done in all of the nursing homes, assisted living, rest homes, has been 21,785. And that's about a 1,500 increase in number of tests from last week. The number of facilities with 1 or more positive cases, which is actually a very good barometer to show that the number is going down, because you have to bear in mind what we're seeing now is a lot of facilities have either no increase in positives and actually are decreasing their numbers almost down to zero. So that's exactly where we want to be. There's been 350 facilities that have at least one or more resident and that's tested positive. I think that's only an increase of about two actually from last week. So that's a very good positive sign. On the deaths, unfortunately, we've had a little bit of an uptick on the number of deaths. Has risen to 4,447. Compared to last week, that's an increase of a little over 400. But bear in mind, we were seeing increases of 600 and more even 3 or 4 weeks ago. So that number is stabilizing. We obviously want to see that go down even further. So just to move right along to what we're seeing now is through the CMS, Centers for Medicare and Medicaid, down through the Department of Public Health and Mass Health, the major change that we're seeing, people are familiar with the CARES Act, which really stands for the Coronavirus Aid, Relief, and Economic Security Act. They can't come up with a longer name, so there you go. The states have to complete 100% of a new focused infection control survey. So that's what we've been talking about, and that's going on as we speak. They have to comply with that by July 31st, this summer. Or if they're not in compliance, they have to submit a plan of correction. So what we're seeing now is sort of what I call moving into the compliance phase of this. So we're seeing a decrease in cases through the state, stabilization of the number of deaths, opening up of visitation hours. All of those are very positive signs. And as we talked about before, the nursing homes are probably going to be last in terms of really seeing this curve bending, but it is starting to begin, and we're very, very pleased with that. The compliance efforts that are going to continue, and we're involved in this, and Matt knows very well as well. Out of 200, there have been 230 nursing homes. Now, these are just skilled nursing facilities only that have been audited between May 18th and 29. And out of those 230, 180 passed the COVID compliance inspection, meaning they feel the state gives a score and they feel like they're really managing to reduce the spread of COVID inside of the nursing home. Another 4950 did not pass, but what's happening is when someone does not pass, this is the good news from my perspective. Rather than just penalize people, we're starting to deploy resources to help them increase and really be at a best practice. So even if they don't pass, the state is now providing auditors to come in and help them. There's some private agencies. We're involved in this as well, going in and looking at what we call a COVID assessment, helping look at policies and procedures, helping train people. One of the most difficult thing is, a lot of these staff really were not trained on how to, what we call donning and doffing of the personal protective equipment. And cross-contamination is one of the most critical ways that we can permanently reduce the infection rate inside the facility. So that's something we're focusing on a lot as well. And just lastly, they really are ratcheting up the penalties, and that's a little difficult if you're a nursing home owner. It's very hard to take that. But I think in the long term, the fact that we're all focusing on the importance of infection control, the importance of COVID competency checklists. There's a 28-point checklist in all of these facilities, and there is increased funding now to be had. So it's like a pay for performance. And so I'm very pleased as someone who's been in consulting in nursing homes for years. I think, unfortunately, perhaps it's taken this crisis to finally convince the state and the federal level to add more resources as well as more funding into the nursing home industry, which I think in the long term is only going to protect all of us. So I'm actually very hopeful on the signs that we're seeing. And again, going back to what Dr. Phil, if I may call him that, had said, the fact that we're opening up visiting restrictions, I think is going to be very positive. If anybody has any questions about the visiting guidelines, call the facility first so you know exactly what to do. We don't want to have families, 10 or 15 people showing up and unloading. So it's good news, but we need to make sure we do it carefully. I would advise to call ahead of time so you know exactly what's expected. Thank you very much, Stephen. I'm always available for questions.
Thank you, Robert Eisenstein, Senior Living Consultant. We're now going to our business segment, and we welcome back Stephen Cole. Welcome, Steve.
Hi, Steve. Glad to be back, especially on a beautiful sunny day. So great information today from the panelists. Thanks to everyone for being here. I'm going to keep it light today. I think it's been a pretty heavy and weighty news week, perhaps, maybe 3 months. But something I want everyone at home to reflect on is something I heard once from Mark Twain. The best way to cheer yourself up is to try to cheer up somebody else. So I'm going to keep it a little light today, and I'll keep it brief. We've teased this for the last couple of weeks now, but it is official. We are launching our quarantine crazy hair and crazy beard competition. And this is intended largely to be a fundraiser for our small businesses. We don't know what those regulations are going to be for phase 2. We'll learn a little bit more on Saturday, I understand. But in order to prepare for any kind of costs that the town and business community is going to have to incur while we go through this process, we want to make sure the community is engaged in a fun way and in a way that helps undercut some of these unexpected costs. So you see on your screen the flyer that the Chamber of Commerce prepared for us, along with our friends at Plymouth. We're sponsoring this along with the Plymouth Foundation is sponsoring this along with the Recovery Task Force. So I just want folks in Plymouth County to be aware, everyone is invited to participate in Plymouth County. You have to submit a photo of your beard or your hair. Crazy is what we're focusing on. But frankly, if you kept yourself together during this whole time and you maintained those standards of quality that the rest of us have all since forgotten, you deserve to be rewarded. So we're going to throw you in also. So there's 6 total categories: crazy beard, crazy hair. There's neat hair and neat beard, and also a before and after. So most dramatic transformation beard and most dramatic transformation hair. Submissions must be of oneself. It must be in the JPEG format and include your name, address, email, telephone, and which of those 6 categories you're applying for. The entry fee is $10 each. 100% of all the admission fees are going to go toward helping our small business community adapt to the new regulations. If you have any questions, my email is in the flyer, but for those folks at home, it's stephen.cole@plymouth-ma.biz. Donations can be received by either PayPal. You can find us through the Plymouth Foundation, or by check mailed to 134 Court Street, Plymouth, Mass, and just make it out to the Plymouth Foundation. If anybody has any questions, be glad to hang around afterwards and answer them. And I am glad to say also that we have our first entrant. I think this man's name is Matthew Muratore. Did I say that right? So you have good competition, Plymouth County. Our very own state representative is the first entrant for the crazy hair competition. So thank you again, Steve, for the opportunity to promote this. And thanks again to our small business community for your resilience, and to our residents, because let's face it, this is one of the best communities you could ever live in or work in. We take care of our own, and I'm just so glad for the information that was shared by our panel. Thank you, guys.
Thank you, Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. I don't know if I can repeat that pronunciation. Matt Muratore, our Plymouth State Representative. I know you're multitasking today. Go ahead, Matt.
Yeah, no, it's I've heard all different versions of my last name, but as long as it's close, I'm fine. I've been called so many other things as well that I can't really repeat on air, but as long as it's close, it's fine. But see my after haircut though, Steve? See?
I'll take a screen.
My haircut this week, see? Looks better. First of all, I do want to acknowledge Chief Botieri and the Plymouth Police and those that organized the event last night, the protest event. It was very well done. First class is how Plymouth goes with everything, and it was first class all the way. There is a video that we as leaders, Ken and myself, and other leaders have put together that if you haven't seen it yet, it's on social media. I think PAC TV is showing it as well. It's really a powerful message that was put out yesterday, and I encourage everyone to share that. I also do want to thank Larry Pizer and congratulate him on his 28 years of service to the town of Plymouth. I got to know Larry for probably the last 15 years from being on the Finance Committee and Select Board, and he is a true professional throughout, and always there for kind words, for assistance for anyone that needed it, and he is going to be sorely missed. So we thank you, Larry, for your service, and particularly your service in the last couple of months. You're a real hero for what you went through. So we appreciate that. And I do want to thank Martha and the League of Women Voters and Larry as well. As Steve indicated, we are actually in session as we speak. So I have my iPad next to me, and we are in session. If I have to cut out for a minute to do a vote, I will. I apologize for that. But we are voting on this bill that you brought up, Martha. And we're going through the 26 amendments as we speak. So I appreciate the input from the league and from you, Larry, because it does help me as a legislator shape the final vote. So I'm doing everything I can with those amendments that you requested for, and we're working through that now. So we will have a vote sometime within the next hour or so on the House side of it. We expected to have it yesterday, but we were in session yesterday, but abruptly at 3 o'clock, we had to end because of the protests on the Common. And there were people obviously at the State House, so they had to evacuate the State House. So, but we are back at it today, so we should get that done, and hopefully over to the Senate if they're still in session today. If not, it'll be later this week or Monday. But I'm confident we'll get that bill passed. Okay, sorry. So looking at the numbers, I'm just going to go through this quickly. It looks like 5% of those that have been tested in the last few days have actually been positive. So those numbers are really going down. So I really suspect that the governor will actually announce on Saturday that we will be opening on Monday. That's my personal belief, because the numbers he keeps looking at, we all keep looking at, are going in the right direction. As Bob indicated, even in long-term care facilities, they're going in the right direction. So I suspect we'll start opening then. In Plymouth, the number of cases are at 545 with 55 deaths. So a slight increase in those numbers from when we were last together on Monday. The 7-day weighted average for positive tests since May 4th has gone down by 79%. The 3-day average since May 4th for the number of patients in the hospital has gone down 53%. And we currently have 1,684 people in the hospital throughout the Commonwealth. 393 are in the ICU, and 263 are intubated. So those numbers have drastically gone down since May 4th. The number of hospitals using surge capacity has gone down 71%. So we have a handful of hospitals that are still using surge beds, and the 3-day average of deaths since May 4th has now dropped to 66%. So we are looking good with the numbers, and we'll continue to monitor that. And I'm sure, Steve, on Monday we'll have more to talk about with the opening of the economy in phase 2, which is the cautious phase. Last night, this happened quietly on the federal level on the Senate, and I'm sure Mike Jackman will talk about this on Monday. But the payroll protection plan got a positive vote from the Senate. The House had already passed this bill. Now the Senate has passed it. So it basically allows the businesses that got this PPP money, that received this PPP money, that needed to either use it in 8 weeks or pay it back within 8 weeks, now has 24 weeks to use the money. And 60% of it now, the minimum 60% is used for payroll now instead of 75%. So I think that's great news for businesses, particularly here in Massachusetts. A number of them are just opening up, will be opening up, or just opened up, or will be opening up, and haven't been able to use the money. And most of them got the money mid to late April, early May. So that's good news there. On the flip side of this, the tax collections came in Massachusetts off by 13%. As we can imagine, we were down $262 million from May. April was down 54%. So we have right now we're looking at a $1.7 billion shortfall in the budget. That's for this fiscal year that ends the end of this month on June 30th. So we're looking to deal with that. We're hoping our federal partners will come up with some money too to help offset some more of this cost that we're seeing. And finally, last evening, or yesterday afternoon, we did on the House side pass a bill for restaurants that does a few things. It allows for mixed drinks to go out with food with a maximum of 64 ounces. So it has to be sealed properly and all that. So if you are taking out, restaurants will be allowed to do this. Again, this is on the House side. The Senate still has to vote on it, so they should be getting this today. they are going to allow for the delay in filing of the meals tax. I know a lot of restaurants have asked about the meals tax. It will need to be paid, but it will be delayed in payment. So you'll see some information on that. There'll be a fee. The fees for these outside vendors that serve, that bring food to your home, like Dash and these other organizations, there's a cap now on how much they can charge. So that will go into effect. It's going to be a 15% cap for a charge. And it'll also allow the local authorities, the Board of Selectmen, Ken and his group, to allow for alcohol outdoors when folks are actually serving outdoors. So more on that to come, and we suspect again the Senate will actually pass this hopefully today. And that is the update for now, Steve. So I do want to mention one more thing. I've never mentioned this before, but we finally have numbers of those that have recovered that have tested positive. To date, as of yesterday, there were 97,964 folks who have tested positive in the Commonwealth out of the 614,000 tests that have been done. And to date, as of yesterday, 80% of those have recovered fully, and that's 78,108 have recovered fully. So that's some good news in all this. And back to you, Steve.
Thank you, Plymouth State Representative Matthew Muratore. On Monday, Matt, Ken, and I will be joined by Sarah Cloud. She's the Director of Behavioral Health. And today, during our forum, she's forwarded a link in preparation for that presentation. It's PCO Hope, and she's going to talk about emotional distress and resources that kind of follows up on our earlier discussion about some of the stress people are experiencing during the pandemic. Also, Peter Parcelin will be here, Plymouth North High School principal, talking about graduation that is scheduled for this coming weekend. And our regulars, Michael Jackman, District Director, Congressman Bill Keating's office, Heather Cosby, Plymouth CPA, Michelle Brady, Director of Elder Affairs in the town of Plymouth, and Amy Naples, Plymouth Area Chamber of Commerce Executive Director. And at this time, we're going to go back to our panel and ask each of them to give us a closing statement now that they've had an opportunity to hear from all of the other members participating today. We're going to begin with Dr. Phillip Triffletti, primary care physician. Phil, what do you want our viewers to remember today for this presentation?
A little bit redundant, but I just want to drive the point home. You have to still be social distancing. You need to wash your hands frequently, as Dr. Wilson was also pointing out. You need to wear a mask when you're around others and going to be within a 6-foot distance. And if you're over 60 years old and you have certain medical conditions, I think you should be even more careful about taking any chances by having any social contacts with family and friends. And then lastly, as I like to say, don't just count the days, make sure that every day counts.
Thank you. Phillip Triffletti is an attending primary care physician, Beth Israel Deaconess in Boston. Dr. Mark Wilson, what are your takeaway for today?
In thinking about our discussion, it reminded me what these stressful times represent. There's lots of anxiety, worries about how to pay the bills, care for the kids, and so forth. And the 2 suicides that we heard about today sadly reflect how challenging these times are. So in my mind, this is all the more reason for us to think about the other people around us, not only our families, but our neighbors, our coworkers, passers-by or visitors downtown, anyone who we cross in the course of our daily lives. We all need to try and be more tolerant and forgiving, but also vigilant and considerate. Life is short and all lives are precious.
Dr. Mark Wilson, he is an epidemiologist from the town of Plymouth. We're now going to move to Christopher Smalley from Beth Israel Deaconess in Plymouth. Chris, you're reopening the campus in Plymouth. What should we know about that?
Sure, it'll be a phased reopening and more information about that early next week. But I think the takeaway is we've safely cared for COVID-19 and suspected COVID-19 patients these last 3 months. At the same time, we're safely caring for patients that don't have COVID-19 symptoms. And as we move forward into the recovery or the reopening, continue to safely care for patients throughout our communities that we serve. And that's really the message to get across to the viewers and to the listeners. And they can also learn more by going to our website, bidplymouth.org, and they'll see a big icon there that says Safe Care. And that's part of our larger Beth Israel Lahey Health initiative that really kicks off next week. So it's a safe place to come for care. As I say on every call or show, if someone's having an emergency situation, don't hesitate, call 911 and come to the hospital. Thank you.
Christopher Smalley is the Senior Director of Marketing and Communications, Beth Israel Deaconess. Martha Vautrain, the pandemic with the coronavirus has thrown a little curveball to the Plymouth area League of Women Voters. As Town Clerk Pizer told us, these are not normal times. What should we remember?
If you're choosing to vote by mail in the local June 20th election, start that process now. And if you think that you want to vote for mail in the September 1 primary and the presidential election November 3rd, watch for the news of hopefully a new and easier way to vote by mail. And remember that you can vote safely if you choose to vote in person. And from the League of Women Voters, I want to say thank you to all the essential workers here in Plymouth and Massachusetts. And thank you also to Steve and PAC TV for having us and this show. It's been great.
Martha Vautrain is doing voter service with the Plymouth Area League of Women Voters. Larry Pizer, our town clerk, what else do you want to close with today?
Well, I also want to say that we always encourage participation in elections, and we hope that people do participate in the town election. We very, very strongly suggest that you do it by mail. Please do it now. Get ready for the town election. Send in your request. You can do it by fax. You can do it by email. You can do it by mail. You can put the request in the same deposit box where the ballot would go, but get to it now. And my final thought is I will talk to you later about that hair contest.
Lawrence Pizer is the Plymouth Town Clerk, ready to send in his application for that contest. But we're first going to go to Robert Eisenstein. He's a senior living consultant. Bob, what should we remember today?
Well, I think the hair contest is a toss-up between Larry and Matt Muratore, but I'm just saying. The fact that we're loosening up visitors is an excellent sign. That means that we're on the right track. We're moving along. One concern is just to be careful when you're visiting. I also want to point out, I think rating infection control is going to become now a permanent metric that we're going to judge successful nursing homes. There will be statistics posted on what's called the Nursing Home Compare website. So stay tuned for that, probably starting sometime in July. So all nursing homes will now be measured on their ability to decrease infections, and that's a good sign. So it's all positive, moving in the right direction. And thank you, Steve.
Thank you, Robert Eisenstein, Senior Living Consultant. Going back to Steve Cole. Steve, your closing thoughts.
Sure. Just want to let folks know that the deadline for submission is June 30th, so you still have the better part of a full month to let yourself go. We'll be making the announcements on July 3rd so that folks will have some bragging rights going into the holiday weekend. We do have it's a low-line goal, guys. I'm sure we can beat this, but if we get 200 folks to participate, that's $2,000 in seed money that we can look at so that we can have other fundraising efforts and help businesses overcome these regulations. Winners, as I said, will be announced on the 3rd. You can do this right from the barber's chair. Take a picture of yourself before they do their magic, right after they do their magic, and from your phone, you can send in the donation and the fee. $10. If anybody has any questions, please send an email to stephen.cole@plymouth-ma.biz. Thanks, folks. Look forward to seeing your pictures.
Stephen Cole is the Executive Director of Plymouth Regional Economic Development Foundation. Matt, we know you're in session. How would you like to close today?
Well, again, I want to thank all the panelists. It's great to have the expertise of Dr. Wilson and Dr. Triffletti on every week, hearing from them, learning from them, and Bob Eisenstein for what he does in long-term care facilities. And as I said recently, having the long-term care facilities now seen up there with healthcare providers in hospitals as well as clinics be on the equal footing is really great to see that they're being helped out and they're going to upgrade to how they're doing things and get funded more would be ideal. So we thank Bob for all he's doing as well. And Martha and Larry, thank you again for what you're doing to help promote voters safe voting. Again, I think this bill will go through today, and we will have some safe voting for September and November. And hopefully the barcoding will be there, Larry. We're pushing for that still, and some other things that the league wanted as well. So we're working on that, and we will see that because voting is important. I think local is probably more important to vote in the local election because that's where you can really make your voice heard. But it's important to vote in every election. So hopefully we get people out to vote on June 20th. And I don't know what to say about Grizzly Adams down there with his beard and hair contest, but it's always great to have the Economic Foundation and the Chamber. We're so fortunate to have these two organizations in the same building and working together to help our business communities. And even if we just try to lighten it up a little bit and help them move forward. We have two great organizations, and we're so blessed with what we have in the business community as well as in our hospital community with BID. We're first class, world class healthcare. We're just so fortunate in this community, and I really appreciate everyone's efforts. I think as I say every day, you want to make sure you're still staying informed. By going to the mass.gov/COVID-19 website. Things change every single day on there, so you want to actually do that. You want to ask any questions, you call 211. If you want to get text alerts, text COVID MA to 888-777, or in Spanish to COVID MA ESP to 888-777, or questions on your health at bowie.com/mass. Again, more will be coming on Saturday with the governor about the phased opening. So I think we're getting a little bit more comfortable, but as both physicians, both doctors said, keep wearing the mask, keep doing the social distancing that we need to do. Remain calm. Let's keep coming together by staying apart. And there's one thing that I thank you to all our, all the people that are working on our behalf, whether it's physical or economic, helping us out. We appreciate that. And also PAC TV and you, Steve. But there was one quote that I heard Michelle Brady from our Council on Aging, Center for Active Living, say on a phone call. I listen to her phone calls when she does them every day. And I like to end it with this today. Try to do one exercise today. Bend over and pick somebody up.
Oh.
Thanks, Steve.
Thank you, Plymouth Representative Matthew Muratore, and to all the members of our panel, Dr. Phillip Triffletti, Dr. Mark Wilson, also to Christopher Smalley, to Martha Vautrain, Lawrence Pizer, Robert Eisenstein, Stephen Cole, and as we circle back to the chair of the Plymouth Board of Selectmen, Ken Tavares, a viewer, Pat, wrote today in response to the comments from Dr. Wilson regarding masks, and she asked that the Board of Selectmen and other boards consider the regulations and the wearing of masks in the community with people still needing to be reminded. Ken, what are your closing thoughts?
Well, first, to address the masks, I do have meetings this afternoon where that will be discussed. It's something that we continually talk about. Going last is sometimes not the best. Every guest that's been here today has said something extremely meaningful and important. This has been perhaps one of the more sobering sessions that we've had. To know that people have ended their lives because of the turmoil that's taking place is sad. And I think that's what keeps so many people working in our community together, is that we want to prevent that. We want to help people. And as Matt said so beautifully, to bend down and pick someone up. Every day, we start off from the town side saying, I think we've seen it all. And by the end of the day, that statement just flies out the window. There are so many things going on in the community that we can't even imagine the impact that it's having on individuals, families, businesses. I want to thank everyone, and I'm not going to even start with organizations or names that work at this every single day. This has been constant since March, but we have no choice. Today is an extremely beautiful day. You'd like to walk out the door and say, it's over. We can carry on, but we can't. There are still so many warnings that we have to heed. So when we start talking about masks and distancing and washing hands, it may to some people sound old and not as important, but it is. We are, as I've said so many times before, trying to prevent people from getting ill. It's not easy. It's going to take a great deal of patience. And some days that's just plain in short supply, that people are fed up and they don't want to go by the rules. But I think we have to step back and say, this is for the greater good. This is part of the story that 100 years from now, they'll say, in the end, Plymouth did what it was supposed to do. It saved its citizens, and we're able to carry on for another 100 years. Stay with it, Plymouth. We can do it. You prove it time and time again. And I am so proud to be a member of this community.
Kenneth Tavares is the chair of the Plymouth Board of Selectmen. He and Matt Muratore will be back again on Monday. Please join us at that time. My name is Steve Triffletti, Plymouth Town Moderator. Thank you for joining us today. Good day.